Professor Chris Whitty is reportedly very unhappy with Boris Johnson's plans for a reopening. The chief medical officer for England was said to be reluctant to personally get behind the policy to stop at the Department of Health and Social Care. DHSC denied the claims, saying there had been no disagreement. The PM is desperate to get children back into schools on March 8 after months of lost education caused by the pandemic, stressing earlier this week that it was his number one. An education source told the Guardian Professor Whitty was very unhappy with plans for all 10 million kids and staff to return to schools in England. They told the newspaper they believed this could be resolved, adding, "Number 10 will come up with a formulation of words that Whitty can live with." A DHSC spokesman said, "The Guardian story is categorically untrue and the reported disagreement is that the chief medical officer, and all the other CMOs, have repeatedly made clear they agree with prioritization of education and the low risks to children." On Monday, the Prime Minister is to reveal his roadmap for lifting national lockdown rules in place since the beginning of the year, with an across-the-board return. However, a coalition of education unions today demanded a phased return to classrooms, despite a dramatic fall in coronavirus infection. A joint statement said, it could trigger another spike in COVID infections, prolong the disruption of education and risk throwing away the hard-won progress made in suppressing the virus over the course of the latest. What we do know is that the full reopening of schools will bring nearly 10 million pupils and staff into circulation in England, close to 1/5 of the population. This is not a small easing of lockdown restrictions. It is a massive step. This statement comes despite a number of health experts and epidemiologists backing the reopening of schools on March 8. A report from the Legatum Institute think tank released today found that getting all kids back into the classroom will only have a minor effect. The think tank says getting all kids back on March 8 will only see 789 admissions to hospital. This is based on SAGE scientist estimates the R rate will increase by 0.2 to 0.5 when classrooms reopen. And earlier this week, Professor Neil Ferguson said he expected all schools on March 8 as cases are having The Imperial College scientist, who is in favor of easing lockdown cautiously, said the dramatic fall in infections meant the government had a bit of leeway to send children back to classroom. Meanwhile, schools in Scotland, Northern Ireland and Wales are taking a phased approach to getting kids back to school. COVID deaths today rose by 533, which a 30% drop on the figure recorded this time. Another 12,027 infections were recorded in the last 24 hours, meaning 4,095,269 people have now tested positive for the bug in Britain since the start of the pandemic.